A Gallup poll in 2023 found that 38% of Americans reported delaying or skipping medical care in the previous year because of cost, the highest share Gallup has recorded since it began tracking this question. A separate Kaiser Family Foundation survey found that 1 in 4 Americans said they or a family member had difficulty affording health care in the past year. This video is not about people making bad decisions. It is about a system that has priced basic preventive care out of reach for tens of millions of working Americans. From cancer screenings and life-saving medications to dental visits and mental health therapy, we're breaking down 10 medical services that Americans are skipping, not because they don't need them, but because they can't afford them, and the devastating consequences that follow. Starting with a procedure where a delayed test can mean the difference between a 90% survival rate and less than 15%. Number 1, colonoscopies stand at the front line of prevention, yet cost keeps millions from this critical screening. 31% of Americans who delayed care reported postponing a colonoscopy or other colorectal cancer test, with the rate climbing to 44% among the uninsured. For those without coverage, a single colonoscopy can mean an out-of-pocket bill between $2,000 and $3,700. Even with insurance, high-deductible plans often saddle patients with surprise charges of $500 to $1,500, especially when facility and anesthesia fees are added on. The consequences of skipping this test are stark. When colorectal cancer is found early, over 90% survive 5 years or more. But if screening is delayed and cancer is discovered late, that survival rate plunges below 15%. Hospitals report a 20% increase in emergency surgeries and an average of $15,000 added to treatment costs when screening is missed. Skipping a preventive colonoscopy does not save money. It simply shifts the cost to a later, more dangerous crisis. In second place, mammograms are a frontline defense against breast cancer. Yet nearly 3 in 10 women who delayed care reported skipping this essential screening because of cost. Despite the Affordable Care Act's promise of free preventive mammograms, high-deductible health plans often shift the bill to patients if the imaging is coded as diagnostic rather than screening. For many, this means an out-of-pocket charge between $200 and $450, an amount that deters 29% of women from getting checked. The problem is especially acute for those under 55 and for lower-income women, with nearly half in the lowest income brackets postponing mammograms. The consequences are profound. Missing regular imaging increases the risk that breast cancer will be detected at an advanced stage, when treatment is less effective and survival rates drop sharply. Skipping a mammogram does not eliminate the cost. It simply raises the stakes, both medically and financially, down the line. Third on our list, insulin and diabetes supplies have become a flashpoint in the debate over medical affordability. For Americans living with diabetes, the price of survival is steep. One vial of insulin now ranges from $350 to $450, and most patients need several each month. 27% of adults with diabetes report rationing their insulin or skipping doses because of cost, a decision that is rarely voluntary. Uninsured patients are twice as likely to forego insulin, but even those with insurance face deductibles and copays that quickly add up. The consequences are immediate and severe. Hospitals in high-cost regions have seen diabetic ketoacidosis admissions surge by 30 to 40%, with each emergency visit averaging $8,000. Medicare's $35 monthly insulin cap offers relief for some, but millions remain exposed to unaffordable bills. Skipping insulin does not save money. It simply shifts the cost from the pharmacy counter to the emergency room, often with life-threatening results. Number 4, asthma inhalers reveal a striking example of drug price disparity. In the United States, a single rescue inhaler can cost between $300 and $400 out of pocket, a price that shocks even those with insurance. Abroad, the same device often sells for less than $10, and in many countries, generic versions are widely available through public health systems. This gap is not driven by better technology or higher quality. It is the result of United States patent rules, lack of price negotiation, and fragmented insurance coverage. For families with asthma, these costs add up quickly. National surveys show that 22% of Americans with asthma have skipped or delayed inhaler refills because of the price. The medical consequences are immediate. Emergency department visits for asthma attacks rise by 24% among those who miss doses. Skipping an inhaler does not save money. It turns a manageable condition into a medical emergency, often at many times the original cost. Number 5, outpatient mental health therapy exposes the deep cracks in America's approach to behavioral health. 35% of adults with depression or anxiety report skipping therapy sessions because of cost, a figure that climbs to over half among the uninsured. A single session often costs $150 to $300 out of pocket, which puts routine care out of reach for millions, especially when insurance networks are thin and deductibles reset each year. These gaps do not just delay treatment, they drive a surge in psychiatric emergencies. Emergency department visits for mental health crises have risen 22% nationwide, with nearly 1/3 of those cases linked directly to people who could not afford outpatient therapy. For many, the choice is stark: pay for therapy or wait until distress becomes a crisis. The downstream impact is both personal and systemic. Overloaded emergency rooms, higher costs, and lives disrupted by preventable emergencies. Skipping therapy does not erase the need for care. It transforms manageable conditions into acute crises, shifting costs and suffering further down the line. Number 6, dental care exposes a fundamental flaw in how American health benefits are structured. 41% of adults report postponing routine cleanings or needed dental procedures because of cost, and nearly 68 million people have no dental coverage at all. For those without insurance, even a basic cleaning can mean an $80 to $200 bill, while a dental crown often runs between $800 and $1,900 out of pocket. These prices push families, especially those with children, into impossible choices. Pediatric emergency department visits for dental pain have climbed 14% in recent years, with each visit averaging $1,250, far more than a preventive checkup would have cost. The separation of dental and medical insurance means that toothaches, infections, and untreated decay often go unaddressed until they become emergencies. For children, the consequences ripple into missed school days and lower academic performance. Skipping dental care doesn't erase the need. It transforms manageable problems into painful and far more expensive crises. Number 7, prescription compliance highlights a national crisis hiding in plain sight. For Americans with chronic conditions like hypertension or high cholesterol, skipping medication isn't a matter of forgetfulness. It is a matter of affordability. 42% of chronic disease patients report delaying or foregoing their prescribed medications because the monthly cost, often between $350 and $550 for brand name or combination drugs, simply exceeds what they can pay. By contrast, some generic medications cost less than $10 a month, but many newer or specialty drugs remain out of reach even for those with insurance. The consequences are staggering. Non-adherence to prescription regimens is linked to 125,000 preventable deaths each year and adds between $100 billion and $300 billion to national health spending through hospitalizations and complications. This is not a problem of individual neglect, but of a system that prices essential medicines out of reach. Skipping medications does not make the problem disappear. It turns manageable conditions into emergencies with a much higher price tag down the line. Always consult your doctor before making any changes to your medication plan. Number 8, physical therapy sits at the crossroads of prevention and crisis for millions of Americans recovering from injury or surgery. 24% of adults report postponing outpatient physical therapy because of cost, an expense that quickly adds up, with each session running from $80 to $150 out of pocket. A standard 10-visit course can mean a bill between $1,000 and $1,900, often due before insurance coverage begins. For many, these prices force a difficult calculation. Pay now for rehab or risk chronic pain and future disability. Clinical studies show that skipping prescribed physical therapy sharply increases the likelihood of needing surgery later and raises the risk of long-term mobility loss. Missed therapy often leads to more time off work and higher rates of opioid prescriptions. The upfront savings are deceptive. Delaying physical therapy shifts the cost to more invasive procedures and prolonged suffering. Always consult your doctor before making changes to your care plan. Number 9, annual physicals and lab work reveal a striking paradox at the heart of American healthcare. 45% of adults report delaying routine checkups or blood tests because of cost, even though the Affordable Care Act labels these visits as preventive and supposedly free. In reality, billing errors, coding loopholes, and high deductibles often turn a simple checkup into a surprise bill, sometimes hundreds of dollars for basic blood panels or a brief consultation. For the uninsured, the out-of-pocket price can reach $250 or more, but even those with coverage face unexpected charges if a test is coded as diagnostic or if the visit uncovers a new issue. This gap in everyday prevention means chronic illnesses like hypertension, diabetes, and kidney disease often go undetected until symptoms become severe. The result is not just missed early treatment, but higher long-term costs and worse health outcomes. Skipping an annual physical doesn't actually save money. It simply shifts the burden to a later, more dangerous stage. Always consult your doctor before making changes to your care routine. Number 10, eye care and vision correction illustrates how even basic sight can become a casualty of unaffordable health care. 30% of Americans report delaying eye exams or skipping new glasses because of cost. For many, an eye exam runs between $80 and $150 out of pocket, while a pair of prescription glasses can add another $200 to $600. Insurance often does not help. 40% of adults lack any vision coverage, leaving them to pay full price or go without. The consequences reach far beyond blurry vision. Skipped eye exams mean missed opportunities to catch early signs of diabetes, glaucoma, or retinal disease. For children, untreated vision problems directly undermine learning and classroom performance. Unlike most other health benefits, vision care is carved out as a separate market, creating yet another barrier to routine prevention. Skipping vision care does not eliminate the need. It simply hides problems until they become more difficult and costly to treat. Always consult your eye doctor before making changes to your care plan. Across all 10 procedures, one pattern is clear. Cost barriers, including insurance gaps, high deductibles, and fragmented coverage, force millions to delay vital care, not out of neglect but necessity. Skipping treatment rarely saves money. It shifts the burden to later, more serious problems. Talk to your doctor before changing any care plan.